The self-declared autonomous state of Somaliland, situated on the eastern horn of Africa, has become an oasis of stability in the region, committed to the principle of peace and coexistence with its neighbors. As one walks through the capital city of Hargeisa and wanders across the desert plains, they come across traditional culture, beautiful nature, and active people full of will for survival and productive development. Since 1991, Somalia had effectively been three countries in one: Somalia in the south, Somaliland in the northwest, and Puntland in the northeast region. For many years, subsequent fighting among rival faction leaders and clans resulted in the killing, dislocation, and starvation of thousands of Somalis. Today, Somalia faces its worst humanitarian crisis in 18 years. 3.64 million people are in need of assistance, while 1.1 million require acute food aid, according to the Office of the Coordination of Humanitarian Affairs of the United Nations, OCHA, for Somali in Nairobi. Amid the chaos, Somaliland has become a success story. The country broke away from Somalia 20 years ago, becoming a self-declared republic. Although not yet internationally recognized, peaceful democratic elections took place in July 2010, and the political system in Somaliland is stable. The new government and international humanitarian organizations are working hard towards bringing back the nation's original prosperity and the people's quality public health, which is extremely limited in the country. Lack of rural and urban healthcare facilities, famine, frequent floods and droughts have deepened the level of poverty in Somaliland. In an effort to help the country brave its way through these challenges, German Red Cross (GRC) is partnering with Somalia Red Crescent Society (SRCS) to provide humanitarian aid and basic services by supporting 4 main programs and activities in Somaliland.
We are operating mainly in the area of Somaliland and Puntland because they are relatively stable and they are accessible for our humanitarian workers. While other partners of the Red Cross movement, the International Committee of the Red Cross, is active in South and Central Somalia, and the International Federation of the Red Cross and Red Crescent together with us in the north.
The organization funds and provides equipment to 4 mother and child health clinics in Somaliland and another 4 in Puntland, supported and managed by SRCS in close cooperation with the health authorities.
There's a good collaboration between the government and German Red Cross and SRCS, and they are happy the activities and the fund which is provided by German Red Cross and SRCS.
The purpose of the primary healthcare project is to provide critically needed community health services through mother and child health clinics, and using a community-based approach, educate the targeted communities on health-related issues. A mobile clinic is used to reach people in remote, rural areas in the desert-like landscape with many ruins of war. The clinics have created health awareness and motivated people to come for medical consultation, antenatal, and postnatal care and treatment. The health status of these vulnerable people is now improving.
Previously, people were getting sick frequently. They don't give more concentration with hygiene and sanitation, but nowadays, that thing has been improved.
The German Red Cross and Somalia Red Crescent Society, it has enabled it to improve the development of this community.
Somaliland can be described as a growing nation with women taking the front line. Though women and girls have no voice, as you move around, you see them working as men take an afternoon break to relax, chewing cud. The practice of female genital mutilation, FGM, has caused many girls between the ages of 4 and 11 to suffer serious health problems, and as women, they later live their lives in pain. SRCS is implementing an FGM pilot project in 6 regional branches in Somaliland, supported by German Red Cross, to address the general population women, youth, practitioners and religious leaders at SRCS clinics. The clinic staff, with the support of volunteers and religious leaders, talk to their respective communities and conduct educational sessions on health consequences and complications of FGM practices. FGM action teams are formed at branch level and anti-FGM clubs in schools and youth centers. New funding applications have been submitted by GRC on sexual and reproductive health to the European Union to expand these important activities to remote and underprivileged population groups.
Impact evaluation showed that there is a tendency of behavior change, of change in thinking and conducting FGM. Nowadays the tendency is away from the most invasive forms to less invasive forms or complete abandonment of FGM.
The civil war in southern and central Somalia has aggravated in the land, shattering the dreams of young people. Joblessness, low rates of literacy and lack of resource and vocational training centers now characterize their lives, bringing in hopelessness. Young people move to big towns in the hope of greater chances for employment as well as a more exciting life, causing a strong migration, environmental damage, and also fueling potential conflict in urban areas. The Somalia Red Crescent Society is committed to motivating and developing the Somaliland youth to excel in out-of-school education and build a strong desire for vocational training and employment creation. SRCS has set up youth clubs, equipping them with computers to increase their access to the world. Through first aid training, youth volunteers are able to acquire life-saving skills, while drama, music, poetry and other forms of art are used to pass on important messages to the community, ranging from environmental protection to HIV and AIDS. German Red Cross is working hand in hand with SRCS to establish and operate youth units that support training and empowerment of youth in civil society development activities.
They made also clean campaigns. They pursued the people, international humanitarian law and the Red Crescent principles.
Since March 2009, Audal, Galbed, Togder, Sahil, Sool and Sanag regions of Somaliland have benefited from this successful European Union-funded pilot project. Lack of sufficient safe water due to poor rainfall causes rivers and water reservoirs to dry up in Somaliland. Heaps of rubbish at water points and destruction of trees indicate massive environmental and health risks.
Before the German Red Cross start doing this project, people they used to drink from the ditch, and we used to get waterborne diseases for many children.
The most affected are women, children, pastoralists, people with disabilities, and internally displaced persons, IDPs, who have been forced to flee from their homes due to violence and war. About 678,000 left their homes during the ongoing civil war in South and Central Somalia in search of safety and shelter in the northern regions and neighboring East African countries, adding to the estimated 1.55 million people already displaced within the country. These displaced families live in deplorable conditions, sleeping in makeshift huts and lacking even the most basic items needed for daily survival. The people's livelihoods and the economy of Somaliland are based predominantly on livestock and to a small scale on agriculture. Water is therefore essential for both human consumption and economic stability. The SRCS has implemented 4 community-managed water and sanitation projects in rural Somaliland with the technical and financial assistance of the German Red Cross and the European Union. The project has helped to increase the availability of safe water for the subsistence farmers and nomads who constantly migrate throughout Somaliland in search of pasture and water for their animals.
5 saacadood si socono 5 saacadood ma soo socono oo noo dhibaan ku heli jirnay imikana barkada agteeda aan ka leeyahay bishaasi noo sameys marka dib ma laha tabaaraba ma laha hadda loo dhabarkan ku soo dhaawi jiray anagoo is sidna.
The project involves the construction of water supply facilities and the rehabilitation of the existing ones. These include shallow wells, buckets or rainwater harvesting tanks, school water systems and toilets.
Hata loo dhawayo dadii hawliyari ayaan ku helay dharkii aan dhaqanaynay hawliyari ayaan ku qasaaranay ari ka warabsaday guri ku shaqaystay wuxuu ma ka waraabiyay ari ka cabay ku faa'iideystay.
Boreholes with alternative renewable energy pumping systems have also been fitted.
Kamida doorta lagu waraabinayo intiyo waxaan ku warisaa midhiga warta ku waraabiyo sarca khayra ku beero leedanaanta.
The SRCS has constructed surface area dams that harvest rainwater, thus putting it back to use. To encourage community participation, the local population has been trained and water communities and local water authorities formed to maintain these systems.
joogteena waxa jira hawl system oo aan ugu talagalay inay ku waarto biyuhu marka lacag dhigaala ayaan u sameeynaa marka dayactir baan ka dhignaa wixii naga xumaada ayaan ku kacsanaa ku sameeysanaa.
The Biomir ceramic family water filter, an effective and affordable flower pot-like device, is used to purify water fetched from contaminated water sources and store the water ready for use by the family. In Hargeisa, a ceramic water filter production facility was set up. New technical investments in a factory's gas oven will increase quality and production numbers in 2010, reducing firewood consumption. These ceramic household water filters are distributed to vulnerable households, while a large number is ordered by international NGOs.
We are promoting these filters in most of our projects to increase the water quality on household level, and it's particular for people who are using open water sources such as burcuts or earth dams.
To replace the dilapidated toilets, latrine slabs and school latrines were constructed for the communities and school children. Students now have access to drinking water and wash hands in clean sanitation facilities. First, primary health and sanitation training is carried out for community members and opinion leaders, while child health and sanitation training sessions are conducted to school children. The hygiene behavior and water quality in the households and these communities has improved tremendously, according to recent project evaluations of the EU. Following disaster emergencies that occasionally affect several regions of the country, in 2010, GRC partnered with SRCS to start a disaster risk reduction project with financial support of the Canadian Red Cross Society.
We are supporting SRCS in Puntland to assess local natural and technical disaster risks and hazards. After these assessments, we are training local disaster response teams, and they are also equipped technically to do their job in cooperation with the local government.
In addition, GRC has assisted in the construction of an SRCS business center in Garowe, Puntland, to mobilize local funds through rental rooms. Over the years, the SRCS has developed good working relations with an increasingly diverse set of people, organizations, and partners ranging from grassroots communities to government and the private sector, bringing hope to Somalilanders.
The government of Somaliland relies on us, and they believe that we are an organization that is capable of doing a good project and that we are serving for our people in a good manner.
Religion has also played a fundamental role in convincing people to embrace development. The Somalia Red Crescent Society rehabilitation programs continue providing services to those injured in war, landmine victims, and other physically disabled people in the country. Working in collaboration with the Norwegian Red Cross, SRCS established orthopedic rehabilitation centers in Mogadishu, Hargeisa, and Galkayo. Access to safe drinking water, basic health care, significant public awareness of the FGM practice and its consequences, and youth empowerment have now become a reality to many. Through occasional monitoring and evaluation, the SRCS staff have ensured sustainability of these projects. With the support of German Red Cross and the tireless work of the Somalia Red Crescent Society staff and its volunteers, development and poverty reduction has been promoted. The president of Somali Red Crescent Society, Dr. Ahmed Mohammed Hassan, is ensuring through his leadership the good reputation of SRCS in all regions in Somalia and Somaliland. Forging ahead, German Red Cross has supported SRCS as a facilitator in developing its new strategic plan for the year 2010 to 2014 as they jointly continue to provide humanitarian assistance and basic services to the vulnerable communities in Somaliland and Puntland. This humanitarian work is done in close collaboration with the International Committee of the Red Cross, ICRC, and the International Federation of Red Cross and Red Crescent Societies, IFRC. We thank the European Union and the federal government of Germany for their continued financial assistance. We need your continued support to carry on our mission for humanity, alleviating human suffering in one of the world's most complex disasters.